Hi, my name is Silvana. I'll be your nurse today. I'll be doing your head and toe assessment. I'll be washing my hands for 20 seconds. Okay, I'm gonna put my gloves on. Okay, can you please state your full name and your date of birth? Perfect. Do you have any allergies? No? Awesome. Okay, now I'm gonna raise the bed to hip level. So I'm gonna make sure the rails are up on the opposite side, and I'll be closing the curtains for your privacy. Okay, so I'm gonna be asking you a couple of questions. Can you please tell me who our president is currently? Okay. Do you know where we are? Okay. Can you tell me what year it is? All right. And can you tell me why you're here? Okay. The patient's not showing any slurred speech. And there is no problems with his vision or hearing. The patient is able to articulate. The patient is in a good mood, and he is showing good hygiene. I'll also be asking the patient, so do you have any pain? No pain? Great. Okay, so now I'm going to go ahead and start your head assessment. I'll be touching you. Okay. So I'm going to be checking the head for any bumps, hair distribution, infestation, and integrity, skin integrity. Now I will be checking your ears. I will be using my flashlight. I will be checking for any drainage, placement, tenderness, and abnormalities. All right, so now I'm going to be checking for your face symmetry. I will be asking the patient to smile. I'll ask him to raise his eyebrows and close and open his eyes. I have noted no facial drooping. I'll also be checking for the patient's color. I have noted there is no paleness, the patient is not flushed, and the skin is not jaundiced. Okay, so now I am going to check for the patient's eyes. I'm going to first ask to make sure that the patient is not wearing contacts, or if he wears contacts, and if he uses glasses. Okay, now I will be checking for redness and any discharge. I will be checking for ocular movement by using the H. Okay, the patient's pupils are equal, round, reactive to light, and accommodated. Alright, so now I will be checking the patient's nose. I will still be using my flashlight. I will check for overall conditions, any drainage and tenderness. I will ask the patient to do the nose test, so I will ask him to close one nostril and blow. Alright, so now I'm going to be checking for the mouth. I'll also be using my flashlight. I'll be checking the gums. I'll be checking to see if the lips are cracked and if there is any swelling in the tongue. I will ask the patient if he uses any dentures, and I will ask the patient to swallow. Okay, I see that there is no problem with swallowing. Now I will be checking I will be checking the neck to see if there's any swollen nodes. So I will be checking the back of the neck, the occipital, which is in the back of the neck. I will be checking for the superficial cervical, which is on the side, and the submental, which is under the chin. I will be checking for jugular vein distension, goiter, and if there is any deviation in the trachea. Okay. Now I will be asking the patient to close their eyes I'll be asking the patient to close their eyes. I'm going to put a mint under his nose so that he can smell. There is no problem with the smell. I will also whisper in the patient's ear. The patient is not showing any difficulty with vision or his hearing. Now I will check for the skin, any breakdowns. I will check for color. I will check the temperature using the dorsal side of my hands. And I will pulsate I will trigger. I will check for turgor by pinching the clavicle. Okay. So now I will be checking the upper extremities. I will check for range of motion by asking the patient to move his hands up and down. I will check for joint stiffness or any swollenness. I will check for the nails to make sure that they're pink and that there is no clubbing. Now I will be inspecting the arms for any IVs. I will palpate the radial, brachial, and ulnar pulse bilaterally. I will ask the patient to squeeze my hand to check for muscle strengthness. I will check the fingernails for any capillary refill. The fingers are brisk, which indicates that they are normal. Now I will be checking the thorax. I will be checking for symmetry. I will inspect for bruising, surgery, scars, respiration, and accessory muscles. I will palpate the chest to check for tenderness. I will now auscultate the heart sounds. I will be listening for the heart sounds through the aortic, the pulmonic, the Earl's point, the tricuspid, and the mitral. Okay, now I will auscultate for the lung sounds using the diaphragm in 6 locations. I will start here. 1, 2, 3, 4, 5, 6. Now I will ask the patient if he has a history of smoking, using any substances, or any respiratory illnesses. Okay, now I will be checking the patient's back. I will be checking the spine for any bruising, scarring, or breakdown. I will check the back for any tenderness. Now I will also check for the lung sounds using 8 places. I will be avoiding the bone. 2, 3, 4, 5, 6, 7, 8. Okay. Now I will be asking the patient to lay down in supine position so that I can assess the abdomen. I will be inspecting for any bulging masses, bruising, drainage, scarring, or distal tubing. Now I'm going to auscultate bowel sounds. I will start with the right lower quadrant, then I will move to the right upper quadrant, then the left upper quadrant, and then I will move to the lower left quadrant. Now I will percuss the abdomen. I will palpate for mass and tenderness. I will start with the right lower quadrant. I will move to the right upper quadrant, then the left upper quadrant, and then the left lower quadrant. Now I will be asking the patient a couple of questions. I will ask the patient if he's been experiencing any nausea, vomiting, any difficulty eating, and I will ask what the last movement was. Now I will be inspecting the perineal area. I will check for any breakdowns, any catheters, and to make sure everything is clean. Now I will ask the patient a couple of questions. I will ask the patient if he's been experiencing any pain while urinating, if he's noticed any blood in the urine, if he's seen any dark or smelled any foul odors in the urine. I will ask the frequency of the urine, and I will ask if the patient is experiencing any burning during urination. So now I will be assessing the lower extremities. I will inspect the symmetry of the legs. I will ask the patient to move the legs up or down. I will ask the patient to move his legs up or down. This will also check for muscle strengthness. I will check for the hips for stiffness or any pain. I will check the skin color. I will check the skin color. I will check the skin for color or breakdown. I will check the calves for any redness, swelling, or heat. I will check the feet. I will check the feet for overall conditions. I will check the bony prominences for skin breakdown. And I will check the nails. I will palpate for edema. I will palpate the dorsalis pedis, the posterior tibial, and the popliteal bilaterally. I will squeeze the toes for papillary refills. The patient is brisk, meaning that it's normal. Now I will ask the patient if they use a walker or a cane. I will also be performing a Romberg test, so I will ask the patient to walk a distance, to stand up, walk a distance, and walk back and have a seat. The patient is not showing any difficulty with gait. Now I will ask the patient a couple of questions. I will ask the patient if they're having any suicidal thoughts, if they've ever thought of hurting themselves or others around them. I will ask the patient if they are taking any medications that might cause drowsiness. And I will also be asking the patient a history of abuse. So I will ask the patient if they feel safe here or if they feel safe at home. Now I will be lowering the bed, making sure that the light is within patient reach. I will make sure that the wheels are locked. I'm gonna go ahead and I'm going to go ahead and take off my gloves. Document my findings. And wash my hands and document my findings. Thank you.